So over the past 10 years, 15 years, pharmacy field has changed dramatically. And I say that because the old degree was called the RPH, Registered Pharmacist, and now the new degree, which is an extra year or two of training, actually involves being the Doctor of Pharmacy. And we are truly doctors of pharmacy. And what I mean by that is we are drug experts. We know the ins and outs of every drug, all the drug interactions, how they can work with other drugs, how they bind to receptors, the structures and molecules of the drugs. So when you come see a pharmacist now, you can expect us to know all the ins and outs.
And I'm letting you know that a pharmacist's role in the community is very important. They look out for their patients, they give you the right dosage, they make sure that your medicine's correct, and they make sure that all the medicines you're taking all match, and they're very valued in the community.
I really do like the pharmacists here where I have my prescription filled. They're always ready on time to answer all questions as needed. They fill the prescriptions accurately. I never have to come back. If I do have a question, I can call on the phone. The staff are always courteous and ready to give a good answer. Thank you very much.
So that brings me to the next topic. So pharmacy, like I said, has been changing so much, and one of the big aspects that we are fighting for now is provider status.
I'm here today to advocate for the passage of bills that support pharmacists as providers. To give pharmacists this status makes sense because they are trained in the delivery, pharmacology, the mechanism of action, and the adverse effects of drugs. They are the drug experts. It is the pharmacist who is the patient's first defense from medication errors.
Also, whenever I come once a year to have my vaccine, to do my flu shot, I come here instead of going to my regular doctor because here it saves me money. And also for my pneumonia shot, here because they save me money and they're gentle with the needles. They don't hurt.
Hi, pharmacists are really good because they go to school, they learn about the medicines and how to dispense them, and also they can give flu shots and immunizations now. So it's really good.
And everybody knows about retail pharmacy. You can go to your community pharmacist and get your prescription, and they know the drug interactions with their particular medication that you may be taking. But pharmacists do have roles in other aspects of healthcare. For example, they can work in the FDA to pass drug regulations or to actually decide whether or not a drug will be approved and used. They can work in a hospital. They can actually go on rounds with your doctor, give you recommendations to your doctor on what you should be getting, or if you should change anything, or if there's any drug interactions. They can work in legislation. They can work, with the government trying to implement new healthcare policies like provider status.
It is the pharmacist who sees the patient more often than any other healthcare provider. For this reason, it is my belief and the belief of many others that provider status should be given to pharmacists.
Provider status basically puts us on equal footing with your doctor or other providers. So your doctor is considered a healthcare provider, your nurse is a healthcare provider, your chiropractor is considered a healthcare provider, even your dietitian. But pharmacists are not considered healthcare providers. And yet we are drug experts. So in order for us to be on equal footing with the rest of your healthcare team, it's important for us to work together with your doctor, with your nurse, with your chiropractor or dietitian to ensure the best outcomes for you as a patient. Once that is passed, being on equal footing with other healthcare providers will ensure patient safety, better patient outcomes, lower costs in healthcare.